As he said, I trained here in GS Medical College, and this is my first visit back here after 25 years. So it feels good to be back. It's also good to know some things don't change. The psychiatry ward is still next to the mortuary, as it used to be. And in those days, we always thought it was very unusual. Why were we next to the mortuary? Why were we not in a different part of the hospital? And as I've traveled and worked over the last 25 years, I've realized that psychiatry wards in many hospitals across the country are next to the mortuary. And that is not by accident, that is by design. We try to exclude people whom we are afraid of, whom we don't understand, and about whom we hold certain stereotypes. And that is what our hospitals try to do. They try to exclude people with mental health problems. Discrimination and exclusion is everywhere in our society. 2 days ago, there was a news item which said that the Miss India contest will not allow you to apply for the Miss India contest if you suffered from mental illness or had a history of mental illness. What mental illness has to do with beauty is something I have not yet understood. And it also means that Deepika Padukone can say goodbye to ever becoming Miss India, because Deepika Padukone has publicly talked about her depression about a year ago. I can give you lots of examples of such discrimination that happens in our society, but since we are in a healthcare setting, since we are in a hospital, let me tell you about the kind of effect that it has on people's lives when we discriminate in our health sector. What happens when the health sector, people like you and me, discriminate against people with mental illness? There is now very strong evidence that people with mental health problems die around 10 to 20 years younger than their peers. 10 to 20 years of low life expectancy. This has been repeatedly shown across countries and in different settings. So it's not just an accidental finding. And if I say this is discrimination, I'm sure you will say, oh, but there could be lots of reasons. It could be the illness, it could be the medicines, it could be all sorts of things. Let me give you one piece of evidence which proves my point on discrimination. If you look at people who had a heart attack, and look at people who had a heart attack and have had a mental illness, they have 40% less chance of being offered either an angioplasty or a cardiac bypass surgery. How do you explain that other than discrimination? Why should somebody who has a mental illness have 40% less chance of getting a bypass surgery after a heart attack when everybody else is likely to get that? I'll give you another bit of evidence. Tuberculosis, which is a really big, important issue for our country, kills about 500,000 people in this country. And that's a revised figure. Until 2 years ago, the government claimed it only killed 250,000 people. And our government very rightly spends about $100 million on tuberculosis programs every year. Suicides kill about 250,000 people every year, about half the number of what tuberculosis does. How much does our government spend on suicide prevention? Nada, zilch, zero. This, to my mind, is discrimination. If tuberculosis is important, suicide is equally important. Why don't we treat tuberculosis? We treat tuberculosis, why don't we do something about suicides? Why is suicides important? Because I don't know if you know, but suicides are now the #1 cause of death among young women in this country, ahead of the maternal mortality rate. We are losing young women to suicide, not to maternal mortality. Suicides are the #2 cause of death for young men after road traffic accidents. India needs to understand that its demographic dividend is actually killing itself. There's going to be no demographic dividend if this continues for a long time. 13% of the health burden, if you add up the entire health burden, 13% of it is made up by mental health problems. And our government devotes 1% of the health budget to mental health. In fact, less than 1%. Is that a fair distribution? Is that equity? Is that not evidence of some kind of discrimination happening? What it results in is a 90% treatment gap. What I mean by treatment gap is that people who need treatment versus people who get it. 9 out of 10 people who need mental health treatment do not get it. Again, to my mind, if this was happening with some other health condition, people would be out on the streets, there would be lots of articles written about it. It doesn't happen when it comes to mental illness. And I think we should ask ourselves why that is so. And it's not actually difficult to treat mental health problems. This is an estimate from Lancet, which says that if you spend $2 per head, $2 per head will reduce the treatment gap by 50%. It's not a lot of money. $2 per capita per year will reduce 50% of the mental health need. And you just heard from the Deputy Governor of the RBI that economics are an important part of our life. And so what am I going to give you now is an economic argument. Every $1 invested in treating mental health gives you a $4 return in terms of social benefits. In terms of increased productivity, in terms of economic growth. That's good value for money. $1 invested, $4 of return. And yet we don't invest that $1. I want you to go home and think, why do we do that? And why do we allow our society to do that when there are paybacks which are good for our society, which are good for the individual, and which are good for our economy? And before I end, I'm just going to remind you that many of you will end up working in a casualty or seeing people in the casualty. Just remember that the next time somebody turns up in the casualty with chest pain and has a history of mental illness, don't call the psychiatrist, call the cardiologist. Thank you.